Our next panel, Supporting Immigrant Families Through Trusted Resources, will explore how clinics can thoughtfully and effectively integrate immigration-related resources into pediatric practice. As many of us know, immigrant families are navigating increasing uncertainty, stress, and surveillance, which hinder them from accessing crucial resources. Today's panelists have seen, through close experience, that healthcare settings can serve as trusted spaces in challenging times, where caregivers can receive guidance, reassurance, and connection. They bring perspectives from clinical care, advocacy, and community partnership work. They will share what they are seeing on the ground, how they stay responsive as policies and community needs continue to evolve, and practical ways providers and care teams can support families with empathy, trust, and confidence. Through real-world examples and actionable insights, this discussion will highlight strategies for navigating sensitive conversations, strengthening partnerships beyond the walls of the clinic, and ensuring families feel seen, safe, and supported. We hope attendees leave today with concrete ideas, practical tools, and resource pathways that you can adapt within your own clinic settings, regardless of size, structure, or capacity. And with that, I'm so excited to welcome our moderator, Dr. Meltzer-Krief, and panelists, Dr. Lauren Jen, Emmanuel Novy, and Dr. Rubuyat Qadeer.
Hi, thank you everybody for being here today. Yeah, we're all experiencing, a lot of trauma to our families, our immigrant patients and families on the ground here. So I'm just going to introduce myself first, and then I'll lead into the other speakers. So I'm Dr. Meltzer-Krief. I've been a pediatrician here in Huntington, Long Island for the past 27 years, and I'm vice president of the New York Chapter 2 American Academy of Pediatrics, which represents Long Island, Queens, and Brooklyn. And Dr. Jen, would you like to introduce yourself?
Thank you. Thanks for having me today. So I'm Lauren Jen. I am a general pediatrician. I am the assistant medical director at Children's Aid, where I oversee our school and camp health programs. And I also see patients in our community health center in the South Bronx. And I am the vice president for New York AAP Chapter 3, which is Staten Island, Manhattan, the Bronx, and then several counties heading north, stopping at about Dutchess and Ulster County. And with that, I will pass it to Dr. Qadeer.
Hi, thanks, Dr. Jen. I'm Qadeer. Sorry, I'm dealing with allergies like probably many of us and a lot of our patients. It's been particularly bad this year. I'm a family physician at Montefiore Bronx Health Collective. I provide clinical oversight for a couple of our programs, including our home program for families who are experiencing homelessness and are living in shelters. And I'm part of the Terra Firma team as well, which is a program we have for asylum-seeking children and families. And I'm a course director for health systems and health equity at our academic institution, Einstein. And so we have a lot of learners who are involved in our work as well. I'm really excited to be here. Thanks for having me. I'll pass this to Emmanuel.
Thank you. And hello, everyone. My name is Emmanuel Novy. I am the Chief of Strategic Initiatives at Literacy and Community, also known as LINC. In my role, I get to oversee our collective impact work, including the Upper Manhattan Early Childhood Connect and Cities First Readers, which you've heard a little bit about today.
Okay, so before we begin, I'm just going to do a little bit of housekeeping. I want us to know we also have the executive director and a social worker from Karasen. We've got, they're in the chat, and they've been providing a lot of resources for us. And if we have immigration questions, either legal or otherwise, they're happy to provide resources within the chat. If you have just comments or reactions, those go in the chat. If you have specific questions that you want to post to the panel, please put those in the Q&A. And there's going to be a lot of resources provided. They're all going to be emailed to you after the program, so don't feel like you have to copy paste and save everything that's of interest to you. You're going to get all of it at the end. So just sit back and listen to the program and post any questions you have. So again, we're all pediatricians, all clinicians right now are aware that our patients are really experiencing trauma and uncertainty whether they're experiencing it themselves within their own families, whether they've experienced separation themselves, whether they've seen it take place in classmates, whether they're hearing it on the news, older kids if they're seeing on their social media, or children who aren't from immigrant families that are just being traumatized by just the images and scenes that we're seeing across our news feeds and that they're hearing from adults chats. So it's traumatic to all children, and it's a real time of uncertainty. And before just we delve in, I wonder, I'm going to pass it to Dr. Jen, if you could just give us a little background on the demographics of our immigrant families, of the specific issues that they face, and the health issues that they have to deal with as well.
Great. Thank you, Dr. Krief. So we think it's important, as we're all here learning about the care for our immigrant children and families, it's important that we're just kind of on the same page of who we're talking about. So looking at the AAP definition, children in immigrant families are children who either they themselves are foreign born or they have one parent who is foreign born. And this definition is a little bit more expansive than the CDC definition, which restricts to children who they themselves are foreign born. But the reason that it's important we expand this definition out is because children of immigrant families who are citizen children born to non-citizen parents do have special healthcare needs. So it is important that when we care for these families, we are treating them holistically and making sure that we're addressing all of their needs. And we can go on to the next slide, please. So the policy statement and accompanying technical report from the AAP breaks down special healthcare needs for immigrant, migrant, and border children. As you can see, there's a lot of overlap here, although there are some distinct needs that specific populations have. So it's just really important that we think about all of these groups as we are seeing them in our health centers. We can go on to the next slide and we'll talk a little bit about exactly what we're seeing. So 1 in 4 children in the United States are children of immigrant families. This is from the AAP data. Looking closer in New York State, the Schuyler Center reports that 37.5% of children in New York State are immigrant children. And in New York City specifically, the data from Citizens Committee says that 1 in 6 children in New York City are in mixed status families. So as you can see, we're kind of comparing not exactly apples to apples, but this is a large portion of the patients that we are seeing here in New York City and the greater reach out and read of greater New York area. In the United States, 23% of children are, oh, if we could just go back. Yep, so 23% of children born in the United States are born to immigrant birthing parents. Apologies, that is a mistake. They're not undocumented. It's immigrant birthing parents. 6% of patients are born to undocumented birthing parents. So we'll make sure that's corrected before we send that out to you. And this is, the AAP data notes that this population is among the fastest growing population in pediatrics. So for those of us who care for children, it's really important that we pay attention to the specific healthcare needs of this population, as this is an area of growth that we'll continue to see throughout our career. So we can go on to the next slide, just taking a look at where, from the Pew data from 2023, where do our immigrant patients live? Mainly in large metropolitan areas. These are where the largest number of immigrant patients are concentrated. We see a big circle here for New York, where many of us are, but also I saw someone joining us from Florida, large immigrant populations in some of the large metro areas there as well. Go on to the next slide. So with Reach Out and Read and all of our communications with patients, we want to pay attention to which languages are being spoken in the home. Taking a look at the data for Reach Out and Read of Greater New York in fiscal year 25, about 45% of patients were reporting a primary language of a language other than English. If we go on to the next slide, we can see what specifically are those languages. So as we Yeah, next slide, please. And so as we expect, the majority of that is Spanish, followed by Arabic, Chinese, Bengali, and Haitian Creole. And for those of you joining us from Reach Out and Read of Greater New York sites, please reach out to your team if you have large populations at your health centers and need books in those languages. It's really important to the Reach Out and Read of Greater New York team. They do an amazing job of making sure that our books are culturally appropriate and that are accessible for our families. Next slide, please. So as I said, it's important that we focus on these specific patients because we know that they are facing specific barriers, barriers that I think we're all seeing every day for those of us who care for immigrant families. And we're going to dive more into the strategies in just a second, but things like language and cultural barriers, immigration status concerns, insurance status, trauma, migration, stress, and acculturation challenges, and mistrust of the healthcare system. And again, this is for both children who they themselves are foreign-born and also children, citizen children born in this country who have foreign-born parents, still face some of these barriers. And we can go on to the next slide, please. Taking a look at some of the common health issues that we have specific healthcare concerns in this population, gaps in preventative and primary healthcare. So seeing patients who are sometimes behind on immunizations and well-child visits, some disparities in dental healthcare, concerns around nutrition and obesity, as well as inadequate follow-up for things like chronic conditions like asthma and diabetes. It's really important that we pay attention to the mental health in this population, knowing that there are high rates of depression, anxiety, and PTSD, and also focusing on developmental and learning challenges in these populations. So much of this is overlapping with what we see, those of us in community medicine taking care of minoritized communities. This is a lot of what we're seeing, but there are specific needs in this population. I think with that, raced through that, so hopefully we can spend more time on a discussion. We can, I think, bring the slides down for now, and we'll bring them back up later as needed.
Yeah, so another thing that that we're challenged with, in addition to providing those needs that you just mentioned to the patients that they struggle with, is actually sometimes having them be comfortable to come to the clinic, right? Like a lot of patients have fear now of coming to visit us when they need to. I've had patients that were, when ICE was in their neighborhoods, there was a large presence. They had called the office and said that they were afraid to bring their children in for their visits. I've had patients afraid to go to the lab to get important testing done. So Dr. Qadeer, I wonder if you could discuss if you're seeing that as well, and how that could be handled, like through telehealth or other means?
Yeah, so our main sites are in the South Bronx. We have a large concentration of various immigrant communities here, and also with the nature of our programs, like I discussed, we have a significant portion of families, children who are asylum seeking or undocumented. And so obviously with the current socio-political climate, there has been a lot of fear on various levels. And what we have seen concretely have been times when either a kid or a mom or a dad have an appointment, and then they call in and they tell us, like, I saw, or either they saw ICE or who they think was ICE at like their bus stop or outside of their subway stop, or they heard about it in their like local WhatsApp groups, and which a lot of our families do. They're part of groups, and it's kind of like this unofficial kind of community watch type of thing, but that has prevented them from coming in. And we have seen that. And so we've offered televisits, which, largely was used, came about during COVID and has remained to varying degrees. But this is one of the instances where it can really concretely help provide the continuity of care. So even if it's something urgent or that shouldn't wait, that we can at least address through telehealth and then follow up in the future when they're more comfortable coming in. It keeps that connection with the clinic, with the clinicians, and that's been really helpful for us. And I think when we have seen families in the clinic, making sure that like it's just a safe environment for them. They see flyers, we have posters, flyers about kind of like community, various immigrant groups. We have Know Your Rights cards available right at our front desk. Like it's very visible. We point them out. And so it's like available for anybody that wants it. I think kind of those are the types of things that send signals, especially if they're new to your clinic, new to your environment, new to the neighborhood, that this is okay for them. Especially because a lot of our patients especially at the clinic I'm in today, is focuses largely on families experiencing homelessness. They haven't, many are from like out of state or not familiar with the Bronx. It's like a totally new environment for them. And I think things like that we already do as part of standard of care, but like not taking for granted, like utilizing our language barrier, addressing language barriers with our interpreters, using them correctly. So it's part of the medical visit and not an additional hindrance for the family. So I think those are a few of the things that come to mind. And I'll just plug Reach Out and Read as well. I think like having like access to books and stories, oftentimes those are the types of things that we use to kind of connect families to, especially if we have it in their language, which we often do, luckily. That's really helpful. So
There's
I'll
also
pause there.
there's also a number of books that specifically address the issue of separation in age-appropriate ways that are going to be sent along with the resources that you'll be receiving, that are great books to have in your clinic. So, Dr. Jen, I wonder if you could sort of discuss the key tenets of care for immigrant children and what we should be focused on.
Fantastic. I think this just kind of provides a framework to all of the things that Dr. Qadeer and his team are already doing, and I think many of us are. Most importantly, should probably be number one, but is using a trauma-informed framework as we are seeing these patients and families, ensuring access to healthcare regardless of immigration status. We'll speak a little bit more about that in a little bit. Also making sure that we are prioritizing confidentiality in safe spaces and care delivery. As Dr. Qadeer mentioned, using professional interpreters, just as this is part of how we conduct these visits. It's not a hindrance. We're not using things like Google Translate or relying on younger children. We are using professional interpreters. If we have staff who are professional interpreters, we are giving them the time and space to be able to perform that duty and not be running in and out of the room to interpret something and then go draw lab work. And of course, making sure that we can compensate our teams for that additional expertise, depending on where our families are coming from and exactly what they have faced, screening for trauma, mental health concerns, and infectious diseases, providing catch-up immunizations and preventative care, integrating our behavioral health in whenever possible. And the last one, which is a key tenet of the AAP, but may not be possible for everybody wearing their own professional hats, but is to make sure that we advocate for policies protecting immigrant children's health. Part of why we are having this discussion now is what we saw in Minneapolis with Operation Metro Surge, where there was a decrease in emergency room visits, yet an increase in admissions to the hospital. So patients weren't seeking care, but then when they did, they were sicker than patients on average compared to that time last year. And we were talking about, the winter in Minnesota. So comparing winter to winter, you're usually having sick patients. So if the next 1 year, the patients are significantly sicker and needing more admissions, that's very concerning. They also saw a decrease in preventative health visits, lapsed immunizations, and things like that. And anecdotally, within New York City, we know we've all seen this, as Dr. Qadeer said and Dr. Krief mentioned, when our patients are receiving reports that there is ICE at the bus stop or ICE outside of the hospital or the health centers, our visits go down, which means that those patients are missing the care that they need. We can bring the slides down now, and I'll turn it back to Dr. Krief.
Yeah, so I wonder, Emmanuel, if you could weigh in about what you're seeing on the ground in the communities.
Absolutely, and thank you. So I mentioned I work at Literacy Inc., or Literacy and Community, also known as LINC. And LINC is an organization that is focused on early literacy. We work directly with caregivers. We engage them very deeply to ensure that they have everything they need to ensure their child is ready to thrive on that first day of school. So as you can imagine, for LINC, trust is everything. And at LINC, we also know that trust is not a single interaction. It's a consistent, long-term experience of safety, of respect, of belonging, and of empathy. And I'm really fortunate to work at LINC because LINC has been deeply embedded in the community for over 30 years. And the great thing about LINC is we don't have one program in a city and move on to the next city. We are here for the long term. As I mentioned, we've been in many of our communities for over 30 years. And that's because we know that families often trust people before they trust institutions. So at LINC, our model, it is citywide, but our relationships are so extremely personal and localized to individual communities. In fact, the majority of our staff were hired directly from the neighborhoods. So they understand the wants and the needs and the hopes and the very real fears of our community because they're from the community. And we even have a really beautiful program called the VIP program, or the Very Involved Parent Program, where after our caregivers have gone through our parent caregiver literacy workshops and our reading programs, they come back and they act as volunteers, as early literacy and LINC advocates, as trusted messengers in their community to talk about how important this work is. As you can imagine, if you are new to early literacy and you find LINC and you now see that their staff is someone from my community, and they now have a VIP, a volunteer who is my neighbor telling me how important this work is, this organization is, I'm going to begin to trust them. And that's when the real impact begins to happen. And I'll also just say, of course, it goes without saying, representation matters so much. Of course, in the programs, I mentioned in the staff we hire, in the books we carefully curate, but also in our languages. It's been said many times today. LINC is always available in English and Spanish, but I also mentioned that I oversee Cities First Readers, which is a collection of 17 organizations, all coordinating and surrounding families with resources and support. And last year, Cities First Readers had programs in over 19 different languages, and we had over 1 million engagements with families. And the wonderful thing about this is that you now have these different organizations with over 1 million engagements, and families are building trust with individual organizations. But because they're part of Cities First Readers, they also know that they can trust LINC, for example, and LINC trusts Trace Out and Read. LINC trusts our local libraries, JCCA, Jumpstart, all of our different partners, so that families get exposed to trusted messengers, to trusted institutions around them they can believe in. And that's when the ecosystem, this real village of support, begins to happen. So at least for me, when organizations can really be consistent, they can follow through, they can create these familiar routines for families, it's when you have these literacy programs and books and organizations that can become predictable and really trusted spaces in a child's life.
Thank you, Emmanuel. And yeah, we've really come to see that ultimately that's really a lot of our community organizations locally that provide the most support for our families and build that trust that they need, where they can go to for questions and concerns. One thing that we could really have a very important role on as clinicians and pediatricians is guardianship. Um, you know, what we find is often when parents or caretakers are taken, if there's nobody who's legally left behind to care for the child, that child goes into the foster system, which is something that we really do want to avoid. Some parents might not want to have that discussion, but it's really important that we encourage them, and we'll talk about how to best do that, to have them fill out guardianship papers. Among the resources we'll be sending you are our official documents that parents can fill out. They're available in different languages, that when they will designate a person who could care for their child in their absence. Um, it's something parents might not want to think about, might want to avoid thinking about, but they also need to understand that their children are worried. And sometimes the unknown for a child is more frightening than anything else. So if they can understand, that there's a plan, and just have discussions with their children about, who would you want to care for you if I had to go away a little while, and do that in age appropriate ways. If they're teenagers, you can speak to them and make them part of the decision, because they're seeing things again on their news feeds. They know what's going on. So if we can make them, just you're reassuring younger children that there's always going to be somebody taking care of them if anything should happen. Just again, the trauma of the unknown, is just the unrest, the unknowing, itself causes daily trauma. So for children to understand that there's a plan in place can be very, very, give them a lot of security. So along with the guardianship resource, there's an excellent resource that Karasten also shared with us. I mean, they put together just last week. Julia Castillo, their social worker, and there's QR codes on there where, both in English and Spanish, where she discusses in age appropriate ways how to have, that kind of discussion with children. So it's really excellent. So I encourage all of you to read that and try and incorporate, those kind of discussions in our practice, and to encourage parents to look into guardianship and to have a plan in place. So, I'm just going to ask, you guys, though, are going to put out, how would you have that conversation with a parent? We don't want to be presumptuous, right? So how would you go about sensitively having that conversation with a parent at an office visit, trying to introduce the idea of guardianship? Anyone have any thoughts? Yeah, so I mean, the way I think about it, I would say to a family, we see everything going on in the news, and we're seeing families are taken, parents, guardians are taken, even, citizens of this country. So, just in case anything like that was to happen to your family, do you have a plan in place? So you're not being presumptuous that they, would have an issue, that they are undocumented, or, and don't have status, but, you're just telling them these things are happening to everybody, and as part of parenting right now, it's an important thing to try and have a plan in place to care for their children until the matter is resolved. So, I'm going to offer up a scenario right now, and see what you can come up with. Imagine that you're in a well care visit with a family and have seen hints of immigration related concerns from the family. How do you bring up immigration related concerns without making assumptions? What language of framing has worked well for you? And, are we documenting? How are we documenting these conversations or status, or are we not? Dr. Qadeer, you want to take a shot at that?
Yeah, these are all really good questions. I think with my approach typically with scenarios like this, and I think just general philosophy in medicine, this is what I talk to learners about all the time, is um, leading with curiosity. And I think that really allows you to meet parents, patients where they are to start with. I can frame this conversation around actually a pretty recent visit I had over the holidays, maybe around November, where there was a young mom who came as a walk-in. I hadn't met her before, so she was new to me. She was having like, palpitations. She wanted to be seen. So we saw her for like a walk-in, and I was just talking to her like, what's going on? Like, really healthy, didn't smoke, no issues. But said that she'd been watching a lot of TikToks about TikToks of students that were getting taken, or news stories of students that were, getting taken by ICE to detention, and the family didn't see them for the. It's happened here in the Bronx. We had a Bronx student here last year as well, Dylan. And it's been like really upsetting to her. And that was like kind of like the main things. And so um, I asked her, is it obviously the videos are really viscerally disturbing, many of them, and there's many of them unfortunately out there. Is it just the videos, or is there a deeper concern you have for your family, for your kids, for yourself? Like kind of like left it open. again, not assuming that there is something there, but she was. And she told me she was a Venezuelan immigrant. Her family, like in the process of seeking asylum, but because of all these different changes, they was very up in the air, weren't clear, couldn't get legal help because their case, like, a lot of other things. But that helped open up the conversation in that moment. And so I think that was one thing that has stuck out to me a lot, especially just kind of seeing instead of jumping immediately, kind of trying to think about like what is it, even if it may be obvious to us, like why they would be upset there. When it's come to like medical visits as well, like where other scenarios have happened to me, where a family or a mom or a dad will say, I don't think actually I can, I qualify for health insurance or for insurance. And I was like, oh, what do you mean? And they said, I can only get emergency Medicaid. And so in scenarios like that, over time, I've learned that like in general, emergency Medicaid, everyone in this country, regardless of immigration status for now, you can get emergency Medicaid. And for many people who are undocumented, they can't get any other form of insurance. And so that's kind of been one of the things that I've kept an eye out for, like without really asking about immigration status, or if they say things like only my kids, yeah, I was like, are your families experiencing food insecurity? How are you all doing with the SNAP? He's like, well, only my kids qualify, so we have to basically for 4 people we have 2 people's worth of SNAP, and it's like, oh, I don't qualify for SNAP. And that's kind of also this kind of idea of also another kind of um, roundabout way without directly approaching it. I think usually then we have a conversation, but there are little things that you can keep in mind of like, okay, maybe I need to ask more, like why that is. Why don't you qualify for SNAP? Is there anything we can do? And that sometimes can be really helpful. And real quickly about documentation. Um, when I really first started, like I've been working as a family clinician post-residency since 2017. I would document pretty thoroughly a lot because I thought it would be helpful and have just documented less and less over time. Especially now, I think for me, the less I can document without it like impacting care, I do that because you see like the ICE is trying to access like Medicaid data and different ways, different types of data points for patients. Patient data is still like HIPAA protected, but you never know how it could get accessed or authorized in the future or possible. And so I think it's kind of more out of being safe. So that's kind of a few things that I've thought about.
Thank you. Dr. Jen, anything to add?
Thank you. I mean, Dr. Qadeer, that's just so wonderful. I think to underscore so many of those same ideas of making sure that we are asking questions, leading with curiosity, but also not necessarily screening for disclosure, being nimble to pivot when, for whatever reason, if we still have suspicions of things, but families aren't necessarily disclosing specific things, providing those resources. Sometimes when I see patients where X is happening, I usually recommend that we think about this resource, or could I show you this resource that some of my patients have found helpful. I think is really important along the idea of documenting, just making sure that what we document specific concerns or specific things that are needed for the health record. So for example, if we have patients who are born outside of this country and didn't have a newborn screen, so we've gone ahead and done sickle cell screening or done HIV screening or other things like that. Just documenting, making sure that those results are visible to others so that they know that in the chart, but not necessarily, as Dr. Qadeer said, explicitly saying why we went ahead and did this testing that we may not have done in another patient. yeah, I think those are some of the some things to add.
So if you had to sort of describe what it would feel like, what does trust look like to you in an exam room with an immigrant family and patients? What does that, how does that go? What is the visit like? Describe the visit. They come in for their checkup. You suspect they're an immigrant family, and do you delve into it at all? How do you approach the visit if it seems like maybe there isn't any issues in there? Do you bring up everything going on? Like, how do you approach it?
I usually, yeah, I think one of my favorite things is food. So like I'm a Bangladeshi immigrant myself, and so like I think a lot of immigrant communities have similar types of foods, forms of food, right? Like rice, like you have different kinds of rice in many different communities, whether they're African, Latino, South Asian, kind of dishes that revolve around rice. And so I often try to like, especially if it's a first visit, when I talk about my background, I talk about things I enjoy, food. I talk about like especially if they're new to the area, like have you tried this restaurant, that restaurant? That's kind of always my kind of go-to. Generally, I just like talking about food, and it's a nice excuse to do so with and that helps lighten the mood as well. And especially if I'm talking through an interpreter, that's also like kind of helps lighten the mood a little bit before you feel like you might have to delve into something heavy. Um, if I feel like they're hesitant to talk about things or it's just a kind of vibe that I'm getting, I often will say like, I have been doing this for 10 years here, like, and I have seen many families similar to yourselves who have often come in and are a little bit hesitant, and it's totally fine. We don't have to talk about anything you want to today. We could talk about it next week, next month, or never. Like, it's up to you. Um, and like a really quick scenario, one time at a shelter, I saw a totally new family, a mom, and she came in with her oldest daughter. The other daughter was in daycare, so the daughter was like 13, and or 14, I want to say. And the mom, typically we say like, we have a confidential portion. You can just step outside the room briefly. We're going to talk to the teenager, and then you can come right back in. She was really resistant to that idea, and I also saw her for a medical visit that day, and she disclosed like she'd had like really severe trauma history. And so I think it goes back to kind of like the trauma informed care. And she just didn't want to leave her daughter alone, especially with a male doctor for the first time. And I said, that's again, totally understandable. And I said, maybe we can get to that point in the future. And after a few visits we did, I was able to talk to her daughter one-on-one. So at least that piece is there, which I think is important for adolescent patients. And so yeah, I mean, I think that those are some of the approaches that have been helpful for me in building trust.
And I think it's great to, even if the discussion doesn't come up in the course of the exam, I think it's important for every family to leave with resources, community resources that they can take with them. We spoke about, the guardianship papers and just maybe just a brief description of what that is if it doesn't come up and its importance. A list of the local food pantries or local organizations that are delivering food. There often are that, when ICE is in town and they're afraid to do their grocery shopping. Karasen, who I mentioned earlier, also has a resource that they've posted that will present office hours to families where they can actually log on. There's I think it's every other Thursday, and they can ask questions about TPS or just legal questions, just to give them resources, of places where they can turn to have their questions answered, because a lot of them do have a lot of questions and worries and concerns that immigrant organizations can really, really help them with. So just important to share with them as many resources as we possibly can on their way out the door. And for the children, again, share books with them, appropriate language books, especially books that might have to do with the current crisis and around separation. Anyone else have anything that they would incorporate into visits during, after?
So we're really proud of some of the resources, and you'll receive these in the follow-up as well, but Children's Aid has put together aggregated some community resources for families to navigate with links for legal services, knowing your rights, legal support, SNAP, also immigrant caregivers and guardianship. So I think there's a lot of different places out there where our families can get resources. And one of the other, I think, networks that can be a little bit confusing for people sometimes to navigate is the Aunt Bertha network at Children's Aid. Our My Bronx Impact works very closely with that network to help connect families to diaper banks, food banks, different resources that they may need within the community. And the Aunt Bertha network is nationwide. So for those who are joining us from outside of the New York area, that is a resource that you can use as well.
So if you guys were speaking to the pediatricians and clinicians who are with us today, what is one thing that every provider could start doing differently on Monday?
I'll see the guardianship. I hadn't really thought about it, so I really appreciate you bringing that up. And I think when we had our background talks as well, because I hadn't thought about it in this context. I mean, and in terms of especially having something in place that if you're not directly talking with families about it, I think that's good. I think it's something that I'm definitely going to bring to our team.
And I think Maria Zocco from Caracen has just posted in the chat that every second Thursday of the month at 7 p.m. via Zoom, there's resources where they have in various languages where they can address families' questions and concerns. I'm not seeing any questions in the Q&A, so we do have some prepared questions here that I think are pretty good. How can clinics train our entire care team, including the front desk staff and medical assistants, to create a welcoming and safe environment for our immigrant families?
And I'll take just part of that, the answer is right then. I think it's very common for all of us to really be thinking about curating our resources for our families and getting together like specialists to talk to our families. I think it's very common that we also forget that our staff are also affected by this greatly too. And regardless of who you are or where you come from, you are deeply engaged in this environment, and it is exhausting and it is heartbreaking. I know for us, both at Link and at Cities First Readers, we put together trainings just for our staff to talk about what happens when you do feel burnt out, or you get that question that just wipes you out. Like, where do you go? And it's not just about talking to your HR team, but it's about like really finding them genuine resources that are as important, as powerful, and as impactful as those for your families too. For example, at Cities First Readers, because of this, we talk a lot as different partners. As I mentioned, there's 17 partners. And this came up a lot. Like, we're all getting exhausted by this. We all don't have the answers for the families always. And we created something we called United for Families Meeting. So bi-weekly, as a coalition, we meet to talk about what's going on in your community, what you're seeing, the problems you're having, questions for the other partners, or just to come to, frankly, just get your emotions out. We've had a lot of tears and a lot of support. But it's a great way to really just know that you're not alone in this, and that there is support for those of us who are helping. It's the Mr. Rogers thing. You find the helpers who can help, and there always are those helpers. So I just keep in mind how important it is to really support your staff who are involved in this.
Yeah, I'm seeing a question in the chat also. How can community organizations support and how can we learn from them? So that's a great question. And I think, if we can actually, as clinicians, take some time to get to know our local organizations better, visit them ourselves, make connections, find out what resources they have available for our patients. They might have a whole lot of resources that we're not even aware of that our patients would be, really happy to receive. So, make those connections, establish those relationships, because we as pediatricians and clinicians, we are community partners as well. And the closer that we can work with supporting organizations locally to support our patients that live locally, the more our patients will benefit. Anyone else have more thoughts on our staff, on getting and preparing our staff for dealing with our concerns here today?
And I definitely think it's really important that our staff is that the whole team is really well versed and comfortable on what to do in specific situations. So trainings for for the whole staff on what is the policy or what do we do if there is, an ICE enforcement or things like that, making sure that everybody knows what to do, and checking in and making sure that everybody feels safe, or for those who don't, that it is established who would be the frontline person responding. I also think it's really important that we are, as I mentioned in conversation around interpreters, that we're valuing our staff for all of the work that they're doing. I think for many of us in community health centers, we are grateful when we have staff members. Someone mentioned earlier, nurse practitioners, physicians, when we have people working in our spaces who are living in our communities. It enhances the care that we're providing for our patients, but making sure that we're supporting our staff. If we are hiring bilingual staff and there is an expectation that they will we are hiring them for their language skills to be able to provide some interpretation, then we need to make sure that we're giving them time to do that, that we're giving them the resources to make sure that they can have the appropriate certificates and things like that. So I think that there's some holistic approaches that organizations can take. So I'm glad that Emmanuel, you also touched on the ways in which our HR can help us supporting for burnout and things like that.
As while we're talking about interpreters, can you guys think of common mistakes that providers make when using interpreters during sensitive conversations, and how can we avoid those kind of mistakes?
Staring at the interpreter, talking to the interpreter, and not actually talking to the family. I mean, this is something like for me too that I had to consciously think about, because they never teach. Now they teach, like we talk about with our medical students, but they never taught us in medical school how to actually use an interpreter in in a sensitive way, culturally sensitive way, relevant way. And so that was one of the things I used to do, especially now with the iPads and things like that, avoiding, make sure it's pointed to the family. These are now seem like simple things, but it's pointed, that they can actually see the interpreter, and that you're not talking to the interpreter or telling the interpreter, tell her this. You're just talking to them like you're having a regular conversation. And inevitably there's always a challenge, even with sometimes there's dialectal issues, right? So even if it's a Spanish interpreter, if they speak a specific indigenous dialect or something like that we can't get, it might be hard to connect. But those, I think when you just starting with those two things, I think sometimes we overlook that, especially on our busy days.
Mm-hmm.
I think those are really important things. The ways in which the video interpreters have enhanced what we do is really important, but we need to cue into it. I think that, it is fantastic to use in-person interpreters when we have them, but sometimes for our more sensitive topics, especially around reproductive health or mental health things where we want confidentiality with our adolescent patients, that is a opportunity or not opportunity, that is a moment where we should utilize the non-on-site interpreter, our remote through either televideo or telephonic interpreters to create that barrier. So perhaps, especially if we're hiring people who live in the neighborhood, if our medical assistant is also a certified interpreter, but also lives in the same, neighborhood as our teenage patient, perhaps they may not want to reveal something. So I think sometimes pivoting and using a telephonic interpreter can be helpful in those situations.
And this isn't about interpreters exactly, but just I know we're coming close to the end. And just another common mistake that I've seen quite a bit, at least from our own experience. I think we all know that the families are they want a lot of information, like they're starving for information. But the last thing to do is just give families 10 pages of resources. Like we don't want to give them more work to do or homework or have them call a place that's been closed or has a waiting list. So the importance of really curating a resource list is so important. And I love to say take the time to do it, but you don't often need to. I'll make a plug. If you're in New York City, come to City's First Readers website. We have an incredible safety kit that is full of course, know your rights items, but also, as you were saying, Dr. Keefe, it's about making a plan. It's books about what happens if someone does get taken away, but also about emotions and safety, or legal services, or how to find diapers next to you. Like there's an incredible, very tight safety kit from City's First Readers that I would strongly suggest. And if you don't have a tight one, I'd recommend taking the time to create one.
So, I guess we'll close with all of that, all this information that we want to be able to provide to them, and addressing their trauma, addressing their fears, the concerns, while also practically, getting these visits done. We already know we have so much to cover in a visit, going over their development and their vaccines and the exam and their diet and everything else. So, what are your tips to clinicians on how to best incorporate all of that in the limited time that we have with our patients? I know it's tough.
Just in a 30-second thing, I would just say to normalize resource sharing. I think it's scared to ask questions and you don't know what you don't know and you don't know what to ask sometimes. And just to make it a part of your program, you're always sharing that resource, I think goes a long way for everybody, regardless of who you are.
Yeah, and I think we do our best, like you said, like to cover, especially now, like we didn't even talk about like, financial squeezes and things like that, the health system that's currently happening. So it's going to be more challenging if it's not already. And you also don't want to like burn yourself out. Also, it can be a lot of information, like it has been mentioned for the family. So that one visit, I feel like doesn't have to be the end all be all there. I think definitely I like to just like say, these are all the things we covered today. Hopefully we could delve more into X, Y, and Z next time, or a follow-up phone call or televisit. So I think like utilizing those resources as well, that you have like quick follow-up appointments and televisits, stuff like that.
That's such an important point, Dr. Qadeer. We all know we're crunched on time and not everything can be done in one these short visits. I think acknowledging that is okay. And I find that, families are always really happy when you call afterwards if you've been thinking about something, or you reach out, hey, I'd like to schedule a televisit to talk about this. Could we find some time to chat over Zoom or FaceTime? I think it's really helpful, and it builds that trust. And it does make it easier when the next time you're in person together to be able to get through all of the things.
Well, I think that we've come to the end of our time. So I want to thank my fellow panelists and everybody for listening. And I hope that you got something out of today's presentation. And again, look out for those resources that you'll be receiving. There's a lot of really, really great information there that I hope you'll be able to use and incorporate in the work that you all do every day. Thank you very much.
Wonderful. Thank you so much, Dr. Meltzer-Krief, Dr. Jen, Dr. Qadeer, and Emmanuel for such an incredible panel and thoughtful discussion. What an amazing day filled with so many important conversations, insights, and shared experiences. And thank you all again for joining us today for our annual Reach Out and Read of Greater New York conference. We're truly grateful for your time, engagement, and commitment to supporting children and families through pediatric care and early literacy. Before we wrap up, just a few quick reminders. Like Dr. McGillner mentioned, on Monday, we will be sending the conference recording, slides, resources, and a brief conference survey. For those interested in receiving CME credits, please complete the survey in order to receive your certificate. Your feedback also helps us guide future conferences and programming, so we appreciate that. We're also excited to share 2 upcoming events. Our award ceremony and live research fair on June 3rd at the Deloitte offices in New York City, and our annual benefit on October 20th at Rebecca Rooftop. On the next slide, you will see also some of the incredible partners and sponsors who will be joining us for the June 3rd event. We hope to see many of you there. And a heartfelt thank you to our keynote speakers, moderator, panelists, and of course, the Reach Out and Read of Greater New York team, and the AAP New York Planning Committee for making today possible. And finally, thank you all for the work that you do every day for children and families. We're so grateful to be in this work together. If you have any questions, please feel free to reach out to any of us on the Greater New York team. Thank you again, and have a wonderful rest of your evening. Take care.